Hi, I'm Fabian, and welcome to this series of the Resilient Networks. This is a collection of short, follow-along videos designed to help give you practical tools for your mental and emotional well-being. Whether you've had years of personal development work, gone in therapy, or just beginning to explore what supports you, my goal is to help you walk away from each video with something that you can use right away and something that really sticks. Oftentimes, we learn skills briefly, either from a friend, family, a therapist, or someone else. And oftentimes, those skills are just, like a one time thing. And what I found is that our nervous systems actually need to practice a little bit more for those things to stick. And so we'll be exploring a few different skills from different breathing techniques that have evidence-based research, or even some cognitive behavioral therapy or dialectical behavioral therapy based tools. And so each video will be short, focused, and easy to follow. And this isn't learning just about how to do something. It's also really working to help your brain and body actually remember to use those skills when you need them the most. And so this is where it gets a little different from a lot of other mental health videos that are out there. After we learn a skill, we might be using bilateral stimulation. Bi means two, lateral means side to side, and that stimulation means that we're just kind of doing some gentle, alternating movements that activate both sides of your brain. So that could be like tapping back and forth like this. That could also be tapping with your toes or patting on your knees if you need to. And really, what this does is it helps connect your left hemisphere and your right hemisphere brain. That right hemisphere is a lot more towards that kind of intuition, emotional intelligence. I've heard a neuroscientist describe that it's a lot more like a stage awareness, kind of you're aware of everything that's kind of there. And the left hemisphere is more of that spotlight awareness. So kind of like spotlight here, spotlight there, spotlight here, and that kind of level of attentiveness to focus on different things, where language resides and logic resides. It's where we are connecting the dots or where the spotlights are shining. And so sometimes we have some information on the right side or one side of the brain that's kind of not really being digested or processed through that language or logical processing. And so this approach, I think, has kind of been really helpful, not just for myself, but for other folks that I've worked with. And so, again, this is a little different in that regard. So, we'll be doing the bilateral stimulation to sink in positive changes that you notice. And then we're going to apply that in a few different ways. You're going to hear a few words sometimes be mentioned. They're going to be rescripting. This is we're going to imagine like a past moment where it might have been a little challenging for us. And then we're going to kind of insert the skill. And we're going to practice as if we're in that moment from the past. And then we're going to experience how it changes, what we're noticing within our bodies as well. And then we'll do some of that BLS or bilateral stimulation. We'll do that for like 2 moments in the past and then 2 moments in the future, which will be rehearsing. And these are approaches that are kind of within the EMDR framework for sure. It's also within something called ICBT, um, which is like an image based or kind of running through imagining those scenarios and future scenarios. And so I found that within those two approaches, but also for ADHD, we are kind of, I have ADHD by the way, but we have kind of the need just to be able to run through a scenario in the future to be able to feel a little bit more confident in those scenarios. So this combination though with rescripting, rehearsing, and helps with be able to not just know the skill, but actually feeling like we can use the skills in our real life. And so I want to be very clear as well. This series is not psychotherapy, and it is not meant to replace the importance and power that therapy is able to offer. We will be working with that in mind. We'll be working with some stressors and really nothing too traumatic or intense. And I'll be clear, if you're needing or wanting to work on deeper issues, it is important to find a trained professional in a safe setting. And so I recommend for a lot of folks to look on Psychology Today. That is not just a magazine or website for information, but it also allows for a searching feature where you're able to find a therapist based on what you're looking for. Getting back to our video series, though, what this is, it's intervention education. That means that we're teaching and practicing techniques that research and clinical experience show can support emotional regulation, focus, and our resilience overall. And so these approaches, again, are to give you a way to be able to check in with yourself, steady your mind and body, and shift your response in moments that really matter. They can help you before either a big meeting, when you're feeling overwhelmed with your to-do list, or if your mind is kind of spinning after a really difficult conversation. The more you practice, the more these skills become second nature. And that's when the real change starts to happen. So give yourself a deep breath. Give yourself permission to be curious and join me in building your own toolkit for mental health and resilience. You don't have to use every tool, but finding the ones that work for you make a real difference in how you move through the world. So let's get started.